Hey guys, I am back with another episode. Shannon Weist is my guest this week. She is the clinical director and founder of Maternally Mindful Counseling Center, and she specializes in perinatal mental health, which includes postpartum depression and anxiety. I was really eager to have this conversation because I know so many women that struggle with this, and I was actually one of them. I had postpartum depression after our oldest was born, postpartum anxiety and OCD after our second, and I didn't even know this was a thing, but I had prenatal depression in my first trimester with our third. My postpartum depression was missed for about a year after we had our oldest because I just kind of chalked everything I was feeling up to lack of sleep and normal parent life. At some point, I did realize it wasn't really getting better and I needed help. So I sought out therapy, and it was helpful at the time. But man, do I wish I could turn back the clock and find a therapist like Shannon that solely focuses in perinatal mental health. You can hear her heart for women struggling in this conversation. I'll leave the link to her website in the show notes, and we'll go ahead and jump right into the conversation. Hey, Shannon, how are you?
I'm good. How are you doing?
I am so good. Thank you so much for joining me today.
Yeah, I'm excited to chat today.
As I was kind of going over everything like in my head beforehand and kind of looking over our show notes, like this is just such an important conversation to have. And I can speak from personal experience. I wish I had had the resources that you are offering. So if you want to take just a quick second and kind of tell us about yourself and about your practice.
So I'm Shannon Weist, and I am the clinical director at Maternally Mindful Counseling Center. It is an agency that I started in 2021, and we've grown to having 4 additional therapists that work with me as well. And our focus is on all things perinatal mental health. So it can be from trying to conceive, if a woman is pregnant, postpartum, dealing with birth trauma, kind of that whole spectrum of things is our niche area.
Like I said, I wish so badly years ago I had had access to something like this. And you said that there aren't very many therapists that are certified this way, right, in Georgia?
Right. There is a network through the Georgia Postpartum Support International where you can go through a process, go through training and an exam to be a perinatal mental health certified clinician. But it really is a kind of a niche specialty area. And there is not a ton of people across the state that this is their sole focus.
So what made you kind of jump into this as your focus?
Yeah. So, all throughout my career, I've done some level of therapy, right? And so I used to see kids and just kind of the whole spectrum. But I have a now 18-year-old son. But after I had him, I struggled with my own postpartum depression and anxiety. And so again, that was 18 years ago. At that time, I was still in grad school, but I knew enough about how the system worked, like logically, I was afraid to be honest with my provider about what I was experiencing because I was afraid that they were going to think that I was a bad mom or I didn't know what I was doing or they were going to try to take my baby away. Like logically, I knew that some of those things were not true, but I think just with the stigma, the lack of support, kind of all those things wrapped up in one, right? Like led me to not be totally truthful about my experience. And I think that I suffered for longer than I should have, just for not seeking the support that I needed out of fear. And so, as I mentioned, so I used to work with people from all different walks of life. And I always knew that this was an area that I was passionate about. And so what sparked me to kind of start my own practice around this is I wanted to be able to, one, instill hope in women that, because when you're in the depths of it, you feel like you're never going to get out of it.
Mm-hmm.
And also sharing the message that this is common. I mean, a lot of times we feel like we're on an island and we're the only one having these thoughts, but 1 in 5 women will experience a perinatal mood or anxiety disorder. And that number is even higher for women of color. It's 1 in 3. And so many women go through this. I just think that it's an important area to kind of raise awareness around and offer specialized treatment for.
I love that you mentioned the fear surrounding admitting some of the things that we think. That resonates so much with me. And I remember feeling shame. I should not feel this way. I should not feel like I don't want to be a mom. And so I'm just so grateful that you brought that up, because I do remember kind of a similar situation, being afraid to really open up because what could that mean? And so I don't know. I just thank you for bringing that to light. And I hope that women who are listening, especially through what you're offering through therapy and counseling. And I was actually looking through your website. What are the different kind of areas in the perinatal field? What services do you offer through that?
Yeah. So, we primarily focus on the individual counseling aspect of that. We have done some group counseling sessions in the community from time to time, but primarily our focus is on those individual sessions. And it kind of depends on what the client is presenting with, right? I think one important thing to note is when you kind of tying it back to what you were saying about the fear aspect, I think the awareness is starting to be raised around things like postpartum depression, as an example, which is amazing, and that we're having more conversations about that. But when we talk about perinatal mood and anxiety disorders, there's a whole spectrum of things that could be going on, right? There's perinatal, so pregnancy or postpartum depression. It could be anxiety. It could be obsessive compulsive disorder. It could be post-traumatic stress disorder based on having a traumatic birth experience, right? So kind of depending on what the client is presenting with impacts the kind of treatment that we give. So I'll give you an example. If somebody is dealing with obsessive compulsive disorder, kind of the gold standard in that area is exposure response prevention therapy. And so it's doing some exposure work around the things that they're afraid of. If it's more of like post-traumatic stress disorder, then we're doing things like EMDR therapy or brain spotting therapy. So it kind of just depends on what they're presenting with, drives the type of treatment that we do.
I think that was something, because my oldest is 14, and 14 years ago, I barely had heard of postpartum depression when I was pregnant and even afterwards. And so when my second came around and I started realizing I was like dealing with postpartum OCD, like you mentioned, and anxiety. And I have a friend who mentioned postpartum rage. I mean, it's just like you said, the spectrum is so individualized and so vast. And I didn't realize that there was really kind of anything outside of anxiety and depression. So, yeah, I can definitely see that. But kind of focusing a little bit more today on postpartum depression and anxiety, what can that look like in women? And how is it easily missed? Because I know mine was missed for a very long time.
Yeah. So many thoughts about that. So I think one way that it's missed potentially is through the screening process. Well, one is, are women being screened for this? Like, that's question number one, because we have found that there are still providers maybe that aren't doing screening, or if they are doing screening, it's a part of the intake process. And it's kind of a situation where you say, here's your stack of papers to fill out and fill out this questionnaire. When you're talking about having some of these thoughts, feelings, emotions around, being a mom, it requires more of a personal touch, right? And so again, I refer back to my own experience when at the time when I was struggling, I was screened, but the way that some of the screeners are worded can cause you to not necessarily answer them appropriately. So I'll give you an example. Like one of the questions might say something like, I've been anxious or panicky for no good reason. And so when that qualifier of for no good reason is on there, that's really subjective, right? And so if I don't have someone kind of talking me through what it's asking and giving some context, like I didn't score that appropriately because my son was very colicky. And so I was like, of course I've been anxious. My baby screams 24/7, right? Mm-hmm. And so I didn't answer it right. And so, but had someone actually had a conversation with me about that, I think also normalizing that experience that, like how I mentioned, 1 in 5 women struggle with this, just letting people know that they're not alone, because if you feel like you're that only person struggling with that, you're not going to want to say that out loud, mm-hmm. right? Or at least a lot of people wouldn't want to. So I think that's one way that it gets missed, is kind of through that screening process and the necessary relationships that need to happen to have open dialogue about that. Another way that I think it gets missed is, having a baby is one of the biggest life transitions that a woman experiences. And yes. So with that, like there is going to be some tears, there's going to be some fears, there's going to be some anxiousness, right? So I think sometimes it gets kind of like brushed under the rug, but not necessarily intentionally, just out of a lack of awareness that like, oh, that's just new mom stuff, right? Like she's just anxious because she's a new mom, or so really understanding when it crosses that threshold between just being like typical things that new moms struggle with versus being something that maybe should be talked about, with a professional. So I think that's kind of another area where it can kind of be missed as well.
What are some maybe more common ways that it can present itself?
Yeah. So anxiety, right? Like, again, just to kind of show the difference between what might be typical and where we kind of start to cross over is, a lot of new moms check on baby in the middle of the night, right? Just because we're like, oh my gosh, I have this brand new little person and I've got to keep them alive and I got to go and make sure that they're breathing. Like that happens, right? But when it gets to the point where it's like almost kind of becomes an obsession, where there's like constant checking, constant worrying, that's when we kind of take a step back and go, are we maybe dealing with some clinical anxiety at this point? Having intrusive thoughts, which again can also be common during this time, but what's the frequency in which these are occurring and how distressing is that? So I'll give you an example of that too. Like a lot of times when you have a baby for the first time, you may have a fear of accidentally like tripping and dropping the baby, right? Like that, a lot of people have that thought, or they're afraid that, they're going to drop them. But if that begins to become pervasive, if you are changing things in your daily routine to avoid the thing from happening that you're having the intrusive thought about, it starts to become something that you're kind of fixated on. We say too, if the intrusive thought, like again, everybody has intrusive thoughts to some extent, but a lot of times what happens is that they pop in your head and you acknowledge, well, that was weird, right? Like that was a weird thought. And then it passes through. But what happens a lot of times when we are dealing with anxiety or OCD is that thought pops up, we're engaging with it and we're getting stuck in it, right? And then it kind of takes over our thought processes. So again, it's more about like the intensity of those experiences when we start to wonder like, okay, is this more of a anxiety or even potentially OCD type situation? From a depression standpoint, again, like some level of sadness and crying and things occur postpartum, at least in those first 10 days, just because our hormones are fluctuating and all of these things are happening. But when it starts, again, we go back to that frequency, intensity, and duration, right? Like, how often are we crying? To what extent, like, is the sadness, right? Like, is it something that we feel like we just can't shake and it's just hanging on us? We start to question if we're dealing with some depressive symptoms. Same thing with anger and irritability. That can be an indication of postpartum depression too. Mm-hmm. Some of the rage that you talked about earlier, right? Like, if we feel like it is starting to kind of take over in our life, like that's like a red flag to say, this isn't something that's just happening periodically or is like a fleeting thought or experience. It's really impacting my day-to-day functioning.
Another thing I personally remember with my first, because I remember I was diagnosed with postpartum depression with her, and I kind of thought this was normal, was wanting to sleep all the time. I had no energy. I was so tired. I was so down about everything. And it was so easy for me to justify it in my head, like you were saying, like, well, I'm up most of the night, like, of course, like, I'm going to be tired. So that was something that I experienced that I remember being like, oh, I had no idea that could be linked, right?
Yeah, absolutely. Like, just not wanting to get out of bed, having that like loss of interest in, activities or things that you were once interested in, which again, like you said, sometimes can be a delicate line because like your life has kind of been turned upside down on its head, right? If you're being woken up by a little one multiple times a night. But again, it goes back to the intensity and severity of that. If you're wanting to be in bed all day, every day, that's more of it's a stronger response than just like occasionally being tired and wanting to take a nap, right? There's a difference in the severity of that.
Yeah. So what's the difference between postpartum depression and baby blues?
Yeah, I think this is a really important distinction. So baby blues is very common. It happens in about like up to 80% of women in the postpartum period. And again, it's due to just the natural hormone fluctuations that are occurring in postpartum. So we say that baby blues typically happens within the first 10 days of the postpartum period. And if it goes beyond that, or the sadness, the loss of interest, the not wanting to get out of bed, those kind of things, if it's lasting beyond that time frame, and if it is intense and severe, like in its presentation, then we may be thinking more of a postpartum depression diagnosis. So basically, if it's going on longer than 2 weeks postpartum and some of those feelings and emotions are intense, that's definitely something worth getting checked out. And we always say, because we do, as a part of our intake process, we do screening as well with the Edinburgh scale. And so we haven't had it happen yet, but it could. I mean, most of the time, by the time women seek out our services, like, we know that they need them, right? But when we're doing that screening process, if a woman were to come in and did not score like above the clinical level, we would have a conversation about, you didn't score necessarily above the clinical level, but we can certainly still have conversations and dialogue and therapy if you would like. Because the other thing is that even though someone might not present with clinical depression or anxiety or any of those things, again, like I mentioned earlier, this experience is the biggest life transition. And so you can still see someone for therapy with what we would call like an adjustment disorder, which basically means that you're adjusting to this new way of life. And that is also a totally valid reason for coming to counseling, even if you don't present with a clinical diagnosis of some of these other things.
Yeah, that makes sense. And again, pulling from my own experience, I remember it affecting my relationships, like affecting my marriage, affecting my friendships, because again, I remember being so tired and just like, I don't want to go do anything. I don't want to talk to anybody.
Yeah.
And honestly, I don't want to be away from my baby. I do remember that, like that intense, like I don't want to be away from my little one for any period of time. So what can that look like? Like from your experience and what you see with your patients, what can that look like for women?
Yeah. I think the relationship piece, especially with your spouse, is a big one. When we have women who are dealing with perinatal mood or anxiety disorders, and especially if they're going untreated, it impacts all aspects of their life, right? It impacts that communication and connection that they have with their partner. The other thing too is that, dads can also get postpartum depression. And that's not something that's talked about a lot too. About 10% of dads also can struggle with that. And if their partner is dealing with a perinatal mood or anxiety disorder, that goes up to 50% of dads could also experience that. So that becomes a tricky situation too, right? If you have both partners who are struggling with depression at the same time, that's an even more difficult dynamic. So you have that as that one aspect. And then the friendship part that you talked about is so critical, because one of the things that we talk about in therapy too, especially during this perinatal period, is, and the research supports this, that social support part is so critical as a protective factor for depression and anxiety and all of those things. And so if you're already struggling with one of these things, right? And then as a result, you're kind of isolating yourself from those relationships that can be helpful in helping to pull you out of your own head, if that makes sense.
Oh, totally.
So yeah, it can, it definitely, it impacts all sorts of things. It can also, when you leave it untreated, it can impact your baby's development. It can impact them with their language skills. Because if you think about, if I'm struggling with postpartum depression for a long period of time, right, and I may not be as vocal with my baby, you can see how there would be that connection of potential language delays. It can impact them in so many different ways. So I think, kind of answer your question in a nutshell, not only does it impact, the mama, it impacts kind of her whole circle around her as well.
I have never thought about it from the perspective of it impacting the baby and their language, like what you just said. I have never heard that or considered that. And I can imagine, too, it also impacts your connection with your baby.
Absolutely, that attachment and bonding piece, which is so important. And so again, like I'm always, whenever I talk about, how it can impact the baby, because I definitely think that that's an important part of the conversation, right? Like I also want to share simultaneously that babies are resilient, because I don't ever want someone who's struggling with a perinatal mood or anxiety disorder to feel like, oh my gosh, I've just done damage to my baby because of this, right? Like that is a reason for hopefully seeking treatment, but also babies are very resilient. And so once you kind of treat that, like because I think there's so much shame and guilt already associated with dealing with some of these things. I never want it to be perceived as like, oh my gosh, like that's just another thing. But I do think it's important to be aware of as far as the importance of treating it, because it's, it can be, cognitively, language wise, baby learning like that serve and return, where you think about how babies learn how to communicate and just engage with the world. Like if a baby is cooing, usually like the mom's response is typically to go, oh, or do something back. But if you are struggling with untreated depression, some of those serve and return opportunities are missed. So yeah, there is from a developmental standpoint, it can impact a lot of things. But like I said, I do want to elevate that once treatment occurs and then, mom's feeling better, that baby will, more likely than not catch up with some of those developmental things if that was an issue.
That makes sense. I mean, just looking at my own kiddos, my gosh, kids are so resilient. They really are.
Yeah.
And going back to talking about spouses, that was another thing I didn't know or really even consider, that your spouse can be going through depression as well. Because, I mean, it makes sense. Their life has completely changed as well. The dynamic between you and him has changed. Like,
right.
That your marriage is kind of, at least it was for mine, put on the back burner as far as some of the important aspects of our marriage.
Yeah.
But also, in addition to talking about spouses, I just remember from way back when, my husband is amazing. And he was like, I got the dishes, I got dinner, I got laundry. And I still remember him feeling lost. Like, I don't know what to do. I don't know how to help her. Like, I don't know how to take things off of her plate, because it does seem like logically taking chores off my plate or just kind of giving me more time to rest or more time to bond with the baby or feed the baby or whatever makes logical sense. I just also remember being like, it's not helping. Like, I don't feel better.
Yeah.
And a lot of it is like, he can't fix. I do recognize that. He couldn't do anything. What are some things that like family members or your spouse can do to kind of help along the way as you're getting, therapy or whatever it is?
Yeah, I think, which is awesome. Some of the things that you shared, it sounds like you have a really supportive husband. I think, having someone who will just do some of the things without being asked, I do think is very helpful. We do say to the extent in which it's possible, right? Because it's not always possible, especially if you're breastfeeding too, but trying to protect sleep. I mean, sleep is one of the biggest protective factors for our mental health. So if that is an option, or if you do pump and someone can bottle feed, the breast milk or whatever the feeding situation looks like. But if there is an opportunity to kind of protect some blocks of time for mom to get some sleep, that's one of the biggest protective factors that, we can have. The other thing is just having an empathetic, listening, non-judgmental ear, right? What we kind of coach families to avoid as they're trying to operate in that listening role is avoiding phrases like "at least." And so, you might hear sometimes if somebody's trying to be supportive, they'll say, "Oh, I know that's really difficult, but at least you're not dealing with blah, blah, blah." And so that feels very invalidating of our experience. So I think just acknowledging that it's difficult, right? That this is a difficult time of life and that it can be difficult, but you can also love your baby at the same time. I think that's an important message to both of those things can be true, right? And I think sometimes we associate with, oh, this is not what I expected. I am not loving motherhood, right? Like, you can feel that and also simultaneously loving your baby. So I think offering supportive language around that is really important from the people that are closest to you. But I think you also brought up a good point too, right? Is that you can have the most supportive spouse in the world and you cannot feel better because it's not necessarily their role to fix it, right? So I think that's another important thing is for family members to just be aware of when it starts to cross the line of typical new motherhood functioning, to where they may need to talk with someone, about what they're experiencing. So I think it's a little bit of both, right? So it's offering that support with household chores, listening, but also knowing like we need to get you connected to someone who can get you feeling better, hopefully.
Yeah, no, I absolutely see that. And I wanted to touch just kind of quickly on some of the other services or some of the other areas of the perinatal period that you guys help in. I saw that you guys help with infertility, birth, trauma, or loss, obviously postpartum. And I think you might have mentioned to me at one point, you guys are trying to branch out into perimenopause and menopause. Is that right?
Yeah. Yeah. So we're wanting to kind of do the whole reproductive spectrum. So yes, like starting to offer counseling around those things, because the emotions, experiences, all the things that come up in that perimenopause, menopause kind of time of life, that is also something that we're starting to talk about more, I feel like, as a society, but we still have a lot of room to grow because there's so much that happens during that time, physically, emotionally, all the things. But yeah, so you mentioned some of the other areas that we see clients for, clients who are going through infertility treatments. And again, with that, there's so much associated with that, right? There's grief and loss work. There's anxiety that can pop up in that, especially if let's say you're going through IVF and you do end up getting pregnant. A lot of times we're seeing more times than not, increased levels of anxiety during pregnancy, which totally makes sense because when you think about everything that you went through to get to that point to be pregnant. So I think that's an area where hopefully we can continue to raise awareness around that. If a woman is going through, fertility treatments, ideally she would be connected with a therapist during that time. You mentioned birth trauma too. I think this is another area where we're starting to raise awareness, right? Like if a mom was dealing with preeclampsia at the time of delivery and had to be on a magnesium drip, as an example, that can be a very traumatizing experience. If you had to have an emergency C-section, there's all kinds of things that can happen during that time. And I think typically the way that it's been addressed is that that was a super traumatic experience, but we just pick up and we do all the mom things, right? And the reality of that is there can be so much stress, anxiety, flashbacks, all kinds of things that can happen when you've experienced a traumatic birth, that if we don't address those, they continue to kind of linger. So, and then the last part that you mentioned, perinatal loss. So we see women who have experienced a miscarriage. It could be early on in their pregnancy. We have seen women who have experienced stillbirth, who have lost infants. So, we provide counseling for all of those areas as well.
I can think of, I'm trying not to get emotional, but I can think of a handful of women that fall within that all of those categories. This is such a huge need, I think. Just, yes. And what you said about, we kind of tend to, as women, go through an experience and then it's okay, but our household still needs to run. We still need to go to work. We still need, our other kids need X, Y, and Z. Our husband needs X, Y, and Z. Our friends, the list goes on. Your role never really it's never done. Your jobs are never done. And from personal experience, yes, I can relate to, all right, well, we got to kind of park this over here. We'll kind of deal with that later, I guess.
Yeah. Yeah. And part of that, part of that is necessary, right? To while I totally also understand, the world can't stop because of certain things occurring, but also this is another one of those things where both can be true, right? Yes, we need to push forward in some of these areas, but we also need to take care of ourselves, because even if we're able to compartmentalize some of those things, they have a way of rearing their heads again, eventually at some point, And so in order for us to show up as the kind of mom we want to be, the kind of wife we want to be, the kind of friend we want to be, all of those things that you mentioned, we have to take care of ourselves. And I think that's another thing that we fight against, right? Is that moms are often superheroes and they hold all of these pieces together, right? But if you are not well, it makes that even more difficult. And also, right, like the level of expectation that we put on ourselves, that
Yes.
just a mom who is dealing with regular day-to-day life and maybe doesn't have any kind of trauma history or anything like that, that's hard in and of itself. But if you layer on all of these other pieces and we're not dealing with them, then it makes it even more difficult than it needs to be, right? Because we're so used to putting ourselves on the back burner. And I think that there's this thread of, it feels almost selfish to take care of ourselves or spend the time, money, any of the things to kind of make sure that we're okay. And that's something that we talk a lot about and hopefully can continue to spread the message about. Like, you have to be well in order to show up in those spaces as the kind of person that you want to be. And your baby needs that. Your spouse needs that. Like, it's not selfish. Like, you have to take care of yourself,
Yeah. Well, and it's easy for me to even think of my own mom and growing up. Like, now my mom's advice to me is kind of what you're saying. Like, don't wait until your kids are grown to take care of yourself. Don't wait until. I mean, just kind of carve out time and make it happen, because I know at the end of the day, for me, I want to show up as the best mom, the best wife, whatever, role I'm walking into that day. So that, I mean, I absolutely see that.
Can I highlight one more thing in relation to that too, that I think we see come up a lot in our practice as well, is even just having conversations around, like, what does it mean to be the best mom, wife, all the things? Because I think a lot of times we envision that looking like we're at 110% in all of those areas. And we just set ourselves up for failure for that, right? Like, when we think about juggling all of these things, we also have to adjust our expectations around, like, what does it mean? What does it look like for me to be a good mom in this season of life, right? Like, you can have your core values and your core pieces that are super important to you, right? As far as how you show up. But is it really realistic for me to think that I'm going to be perfect in all those areas? So I bring that up because that's a common conversation that we have with probably almost every woman that we see in that postpartum period, is just being kind with yourself and knowing that you can show up as an amazing mom, but we have to kind of potentially tweak our expectations around that a little bit. Otherwise, we're going to run ourselves into the ground.
Yeah. Yeah. This is just so good for me to hear on some level too. So thank you.
Yeah, absolutely.
You also had mentioned when we talked a couple weeks ago about the Georgia Fund for Perinatal Mental Health. I had no idea that this was even a resource for women.
Yeah, it is an amazing resource. And we're so grateful to have this opportunity, in Georgia for this. So it is a partnership between Postpartum Support International, the Georgia chapter, and the Department of Public Health. And so they offer grant funds for women who are uninsured or on Medicaid to receive 10 free counseling sessions with a perinatal mental health certified clinician, which is amazing, right? Because I mean, that's, when you think about that, like dollar amount wise, that would probably, if you were just doing self-pay, I mean, that's over $1,000 worth of services that can be accessed for free. So it's just so exciting that they're able to offer that and making care more accessible. So in order for women to qualify, they have to be uninsured or on Medicaid. They have to be currently pregnant or postpartum up to 2 years, dealing with infertility within the last 2 years, or having a perinatal loss within the last 2 years. So again, it kind of covers pregnancy, postpartum, fertility treatments, loss. So it is an amazing resource for our community.
Oh my gosh. I actually went and looked it up after you mentioned it to me. And I've never heard of that. So that is such a cool resource. But then speaking of resources, how can people find you?
Yeah, if they want to check out our website at maternallymindful.org, you can kind of see our different therapists, what we're about. We have a blog section that talks about all kinds of different things perinatal related. Also talks about other things relationship related, right? Because I think this is an important point to bring up too, that when we're talking with our clients, we say, so something within that perinatal realm brought you to services here. But I mean, we're not one dimensional, right? So oftentimes we'll say, so let's say your perinatal depression brought you here, but there are other things that kind of float around that and also contribute to that. So it could be relationship difficulties. It could be boundary issues. It could, there's all of these things that kind of happen. So we're starting to have some more blogs around some of those things as well. There's a contact us section on our website. And I would say, because sometimes for whatever reason with that plugin, it seems to be a little glitchy. So if someone were to reach out, and you should hear back within 24 hours. And if you don't, please reach out to us via phone or text, because that means that there's something that's glitched, because we are very responsive. They can also just text us at 678-310-9216 and just say, hey, I'm interested in setting up a consultation, and we're happy to do that. And we offer a free 15-minute consult, because again, it depends on the client, but some people want to just meet with the therapist, see if it's a good fit. So they have the option to do that for free before they actually jump into therapy. And then other people just want to jump right in for a session. And so then we can schedule a full consultation for them too.
That's awesome. I will make sure to have all of those links, your website, the link to the Georgia Fund for Perinatal Mental Health in the show notes. So for everybody listening, make sure you find those resources there. And thank you so much, Shannon. I feel so honored that you took just time out of your day to have this conversation with me. And I think the biggest thing I've probably one of the biggest things I've gleaned from this conversation is just I can really hear your heart behind what you do.
Appreciate that.
And like I said, I wish I could rewind the clock and find you. But I'm just really thankful that you sat and shared this. So hopefully we'll have you back soon, because I think you have a personal story too.
Yeah, I would love to chat about that. So, and just thank you for giving the time and space to have this conversation. Again, we just want to raise awareness that women are not alone, and that it's more common than you think. Because again, it's so easy to just feel like you're the only person experiencing this, and it's so common and easily treatable. I think that's the other thing too, is that the sooner you can recognize that you're struggling and the sooner we intervene, perinatal mood and anxiety disorders are have one of the highest success rates as far as if you implement treatment, the likelihood that you're going to make a full recovery is very high. So I think just raising that awareness is so important.
Well, thank you, Shannon. I'm so looking forward to part 2.
All right. Awesome. Thanks so much.